Hello, my name is Mr. Mahmoud. I'm one of the trust grade registrars at Dorset County Hospital, England. Today, I'm just going to talk you through one of our interesting audits that we've done as a DGH in England about the imaging modalities to diagnose an occult femur fractures. This is our current practice at DCH. So femur fractures are one of the most common fracture specialty in the older communities, and geographically speaking, our hospital sees a fair amount of femur fractures every day, and we treat them. I would say on a daily basis. So essentially, as you all know, X-ray is usually sufficient to diagnose an femur fracture. However, in some situations, it can be a bit tricky. There's an occult fracture. X-ray might not be sufficient. And these occult fractures could actually be between 2 and 10% of the all femur fractures that we see. So the NICE guidance is actually suggests that we do a next step imaging as an MRI. However, in some DGHs, MRI can be proven difficulty, and it can sometimes slow things a bit, or get the operation later on for the patient. So that's why sometimes we get to opt in for a CT rather than an MRI. So today, the aim of the audits were to understand our practice and actually understand how, according to the national guidelines, are we adherent to. So as I mentioned before, the national guidance or the NICE standards are they recommend that we offer an MRI scan if a hip fracture is suspected despite a negative X-ray, and with a high suspicion, obviously, of an femur fracture. If the MRI is not available in 24 hours, or if there are any reasons that makes it contraindicated, then we should offer a patient a CT scan. So our sampling, so we've collected the data about the for all patients that presented within a 6-month period was suspected femur fracture. We did not exclude any of the ages or anything. So any patient suspected with a femur fracture was included in that study. We collected the data from both CTs and MRI when we considered it positive if it showed an extracapsular or intracapsular femur fracture. And that was, as I said, it's a period of 6 months. The only excluded patients were the polytrauma patients, pelvic fracture, including acetabular and pubic rami fractures. So our findings during the audit, we requested a 48 CT scan and 2 MRIs for especially a femur fracture. The mean age for these patients was about 83, ranging between 53 and 98 years old. As you could see here, out of 48 CT scans, only 25% of them were found positive for a femur fracture, while 75% were proven negative. Talking about MRIs, we've only, as I mentioned, had to request 2 MRI scans. One was preceded by a negative CT report, and one was a straight MRI scan, and both were negative for occult femur fractures. So it's just some observations that we've noticed during our studies, that 10 of the positive scan were done during 24 hours of the initial X-rays, which what the NICE guidance recommend, which is the 24 hours period of since the initial X-ray if they were negative. CT scans that were done out of working hours were about 33%, and 10 out of these 12 positive CT scan had an X-ray that was reported as an off. However, the X-ray obviously was reported retrospectively after the CT scan, so we were not quite sure if the X-ray was that obvious for a radiologist, or they had to look into the CT scan retrospectively when they were doing their CT reports. So there were obviously some study limitations, which is one of them is the relatively small number of a patient, and we've only done that in one center rather than a multi-center study. Even though that, as I mentioned before, that's in our DGH, because of our because the nature of where the hospital is located and elder population surrounding. So we see a fair amount of neck of femur fractures. However, I do understand that it's not a massive center or a massive trauma center. Also, that study has also has only been done over a period of 6 months. So in conclusion, given the study limitation, we have concluded that the MRI, yes, it will stay as our golden standard to come back to or come back on the for diagnosing hip femur fracture. However, at the same time, a CT can be a suitable outcome or a suitable alternative imaging modality to diagnose a neck of femur fracture, especially if we're talking about patient that get admitted in late hours of the day, and we do not want to delay their operation or the diagnosis to receive their operation. We recommend that we repeat that study over a longer period of time because, as I mentioned, that it does actually have a really good potential of having a CT as well as an MRI included in the NICE guidance if it's got the CT's got a very high sensitivity on diagnosis of occult neck of femur fractures. So if that is done over a longer period or a multicentral, I expect that will have a more reliable results, and we can actually take things forward from there. I'm more than happy to, if anyone wants to get in touch, to start a multicentral study. And thank you very much.